Good evening, everyone, and thank you for joining us this evening. My name is Ana Sofia Ore, and I'm a general surgery resident at the PI Deaconess in Boston. And I've had the pleasure of being the co-director of Inside the Operating Room for this past academic year. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons. And today's event is in line with this mission. We want to thank all of you, our members, for supporting and believing in the Latino Surgical Society. Tonight, I have the pleasure of welcoming Dr. Navarro for the 16th installment of our series. Dr. Ronald Navarro is a Hispanic American born to immigrant parents and raised in Wilmington, California. He trained in the public Los Angeles school system. He overcame all odds and is now a board-certified orthopedic surgeon who works intimately in the same community where he was raised. Dr. Navarro is the Director for Clinical Affairs at the new Kaiser Permanente School of Medicine, where he aids medical students with many partners in the clinical integration of their studies into the Southern California Permanente Medical Group practice via longitudinal integrated clerkships. He's also attained the academic grant of full professor of clinical science in orthopedic surgery in the Department of Clinical Sciences at the KP School of Medicine. He is separately also the Southern California Regional Orthopedic Chief with responsibility for orthopedic clinical care in all Southern California KP, in collaboration with 13 different medical center ortho chiefs since 2013. He's also now Inter-Regional Chief of Ortho for all the regions of the nation of KP. He joined KP as an orthopedic shoulder and sports medicine specialist in '97 after a fellowship in shoulder surgery, arthroscopy, and sports medicine at University of Pittsburgh. Dr. Navarro is a proud fellow of the American Academy of Orthopedic Surgeons and is currently a member of the AAOS Shoulder and Elbow Registry Steering Committee, chair of the AAOS Central Instructional Course Committee, and part of the AAOS Leadership Institute Mentoring Group, and is a member at large for the AAOS Now editorial board. Thank you and welcome, Dr. Navarro. It's a pleasure to have you here with us today.
I'm really excited to be here, and thank you for the kind introduction. I'm excited to share some of my experience and hopefully can help others like you and I who are trying to achieve and sometimes face barriers, and still we're putting forth our best efforts. So excited to be here. Thank you.
Thank you so much. And then I also want to welcome tonight's session moderator, who is Dr. Ivan Garcia. Dr. Ivan Garcia is originally from Los Angeles and attended the University of Southern California. In college, he developed an interest in sports medicine while working as a student athletic trainer with the USC Athletic Medicine Department and as a physical therapist aide at USC University Hospital. After graduating from college, he taught high school biology and chemistry in an urban school in LA. He then attended medical school at Wake Forest University School of Medicine. He returned to Southern California and completed an orthopedic surgery residency at Harbor UCLA Medical Center. After residency, he completed a year-long fellowship in the University of Southern California, focusing on sports medicine injuries and complex shoulder surgery. He joined KP as an orthopedic surgeon in 2011, where he is currently a shoulder and sports medicine surgeon. He's currently the Southern California Permanente Medical Group Regional Lead in Sports Medicine and Shoulder Surgery. He continued to remain active in educating and training future orthopedic surgeons. He was previously attending surgeon and co-director of sports medicine at Harbor UCLA. He currently trains orthopedic surgery residents through his role as adjunct assistant clinical professor from the Keck School of Medicine. And he's also a fellow of the American Academy of Orthopedic Surgeons and for the Society of Sports Medicine. Thank you so much, Dr. Garcia, for joining us tonight.
Thank you very much, Dr. Ore. Thank you so much for this invitation. It's a sincere honor to moderate this session. I commend you and the others of your founding society for what you're doing. And I'm honored to be here to talk about Dr. Navarro's great story.
Great. I will let you two talk.
Great, thank you. So, Ron, good to see you.
Hi, Ivan. Should I call you Dr. Garcia?
It's okay, not at all. So I think, as I said, you got a great story, and why don't we start with that? Why don't we talk about your background, where you're from, and why did you choose a career in medicine?
Oh, thank you, Ivan. It's great to hear your story again and your introduction, and it harkens to some of the reasons for my story. You know, I'm one of 5 boys raised by Mexican American parents. My dad was born in Mexico. My mom's parents were born in Mexico, and she just attained a high school education. He had really no formal education, but ran a really stern ship and really expected a lot out of his sons. And I was the youngest, and so I probably benefited from a lot of their experiences. It kind of was able to polish kind of my English more and my approach to life more. But clearly, the cultural mores of being a Mexican American in the 70s in Los Angeles are not lost on me. It's really colored who I am. I have a twin brother, and so he and I competed a lot in everything. We're very close and we're dear friends, as I kind of hope that I think you're a dear friend of mine too, Ivan. And that competition, though, spurred us to really kind of try to achieve it to greater heights. And so after high school in the LA City school system, which, you know, I love it, I'm very proud of it, but it may not have prepared me as well as other systems could have. Went to Stanford University, enjoyed my time there, and my twin brother was at UC Santa Barbara. So after 2 years, I joined him for 1 quarter of my junior year. Liked it so much that I decided to stay. And, you know, a lot of this is about the future and the careers of a lot of us, whoever may listen to this at some point. But when I told my parents that I was leaving Stanford, you know, they probably did not have the complete understanding of what that fully meant in terms of what most people would first respond. And they just said, hey, if you're going to have more fun and be with your brother, family first. And so I think it's important for everybody to understand that you have to do what's best for you. And we'll probably have multiple different levels of people listening. And so I think that that's a great little story in and of itself, that you should probably go to where your heart is, where you're happiest, because then you'll probably have greater performance when you're in a more comfortable state. So after UC Santa Barbara graduation, I went on to med school at University of Illinois. And like you left Los Angeles, you left for Wake Forest, I left for Illinois. So very interesting parallels. But I think that also helps people to grow up, because when you leave the comfort zones of the places you really love, you actually respect and appreciate them more, but you also learn to kind of coexist with others who aren't exactly like you. And I think there's a lot of lessons to be learned in that. And then after my time at University of Illinois, I wanted to get into orthopedic surgery, and truth be told, I didn't get in. And so I did a year of general surgery internship at Harvard General, where you matriculated through as well, and then did 2 years of research at UCLA, both in the UCLA system proper, orthopedic department, as well as in their Veterans Administration VA system, and then got back into orthopedics back at Harvard General. I predate you a little bit, Ivan. I'm a little bit older than you, and had a really great time learning orthopedics. Really, it propelled me into fellowship for a year at University of Pittsburgh. I think Anna had mentioned that, and a really critical time for me. Met some great mentors, among them Dr. Freddie Fu, he recently passed away, was one of the greatest knee surgeons in all of the world, and then Dr. J.P. Warner, a great shoulder surgeon. So really great mentorship out of them, and then came back and did a year of training I did a year of private practice in a private system, hired on by one Richard Zapanta, who's a really great leader, who's also just passed away, a great mentor to me, and also I know to you. You've had a great relationship with him when he was alive, and he's mentored many Latinos in Southern California. And but after that year, a great job opened up for me in Kaiser Permanente, and I was able to take that. That was in 1997, and the rest is kind of like a series of jobs, and I'll let you ask questions so I can stop talking and hear you.
Oh, that's great.
But that's kind of the short story. And
Right,
you know, without saying it goes. It was a lot of heartache and learning and tough times and all that, but a lot of years from high school on to being an attending at in the Kaiser Permanente system.
I do want to, you mentioned Dr. Zapanta, and you know, we could potentially have someone watching this because Dr. Zapanta was one of the first, him and his brother, who was a neurosurgeon, where I just want to give them a highlight because both of them were two of the early surgeons, one orthopedic surgeon, one neurosurgeon, Latino surgeons, excuse me. They went through the USC and they mentored so many people in the Southern California area. So I'm so glad that you mentioned them. I was curious, so, and you have a great story, and that's one of the things I've been excited about talking about your story tonight. What ultimately led you to say, you know, I want to become a doctor, or what I want to be a surgeon?
I kind of went through the
No, that's great.
without the color.
Did you know you wanted to be a surgeon, or did you say I want to be a doctor?
As a boy in a family of 5 boys, and as a twin, we had one older brother who was an athletic trainer, like you had studied athletic training, and he was at Cerritos Junior College in Southern California. And after we'd play our high school football games when we were younger, we'd go watch his games. Our games were Friday night. His games were Saturday night. We'd be on the sidelines with him. And I'd say to him, his name is Steve. I'd say, Steve, what you do is really great. I'd like to do it too. And he calls me Ronnie. My whole family calls me Ronnie. He'd say, Ronnie, you're a lot smarter than I am. You're doing really well in school. You don't want to be an athletic trainer. You want to be an orthopedic surgeon. And like a lot of Latino families, I don't mean to generalize. My next question or comment was, what is an orthopedic surgeon? Because as you might know, my dad was a longshoreman, so we had family dinners with bricklayers and mechanics and guys who were cops, not orthopedic surgeons.
Right.
So out of sheer ignorance, I was like, oh, what do they do? I take care of the injuries on the field. They take care of the injuries in the operating room, the long story short. And so he got me in touch with a number of orthopedic surgeons. And really that was the impetus really was him. I owe him a lot. To show me something more. And that's what our mentors do, right? They not only give us advice on the phone, they actually put us in positions to succeed. That there's that thing that people talk about often, mentorship and sponsorship, and mentors can get on the phone and give you advice. Sponsors kind of put you in situations that kind of can grow you. And maybe you and I can talk about some of the things that you and I have done together. And I think you would agree, you see that as sponsorship. So after he got me involved and invested in that, I had to do a lot more thinking about it and understanding it. But I mean, that was the start of it all. And then you have to learn more about what this really means. But I will tell you that in my 10th grade autobiography, I was in an English class. They made you write an autobiography. I said I was going to be an orthopedic surgeon and practice in the community that I grew up in. And that came to be true. But, there were many potential off-ramps from that story that I would have, eventually taken a job on the docks, and it was a longshoreman with my dad.
Admirable, but not your ultimate goal, right?
Yeah.
Now, you mentioned in your story you were at Illinois, right? So different from Southern California. And you mentioned that you didn't get in to orthopedics and you decided to do research. So that's a decision that some of us make sometimes, or we have some challenges that come our way. So how did you come to make that decision where,
Sure.
you know what, I really want to do this, and this is what I'm going to do because I'm going to pursue my goal?
As after 4 years in Illinois, being a Southern Californian, I wanted to come back home. I knew that for sure. And my family was not a family of wealth. So I also knew that I needed, in order to work, I needed to do a year of internship. So I knew that I was going to go back to LA, do an internship. I didn't really even know that much about Harbor General because my dad's insurance through being a longshoreman, it's a unionized group. We had actually Kaiser Permanente insurance growing up, so we didn't have to go to the county hospital. we went to the, we leveled up a little bit, if you will. We were at Kaiser, and some people, even back when I joined Kaiser, it wasn't as reputable as I believe it is now. But I didn't have a great experience, but I wanted to get back to LA. So I did the internship, and I knew that I could become a full-fledged, a doctor with a license so that I could moonlight and that sort of thing. And I just had to look at my record and say, what can I do to make my situation better and potentially match in orthopedics? And for me, the answer was, to take that time, 2 years, and do a lot of research and trying to forge more connections, because especially back then, it's still very hard to match into orthopedics, and there's papers written about it now too. In this last cycle, there were, I think, 899 spots and about 1,500 people applied. So that left over 600 people very unhappy. And so in those days, it was probably even less open to diversity, less open to different thinking about kind of trying to make sure that the communities were being treated by people that look like them. It wasn't as big a deal. So I had to forge connections deeply with people who had influence. And so it was my choice to do the internship so I could make some money and moonlight at night, and do day research and try and create connections. So I did a lot of research with the UCLA group, biomechanics research, total joint research, other research that was clinical, and went to a lot of meetings and met with a lot of people. But I had already told the story. I eventually ended up matching back at Harbor, where I did my internship, because of those relationships.
Right. So you felt those relationships you made during your research year with some of the attendees and the researchers are what helped you get into your residency.
Yeah, because I think, where a standardized test score may not have been as good as others at that point, I think that people tend to see your work ethic, and they see that you're the person who, when it's 7 or 8 o'clock at night, and there might be another case that they need a hand on, you're willing to stay. They see how you, if there is a problem with a patient, you'll get in the car and come back. And I think that really speaks volumes about the kind of doctor you'll eventually be, because we don't take standardized tests as physicians, as you know, Ivan. Right. And so although that's the thing that measures many, it's not the thing that measures what a good doctor is at all.
Right.
And I'm not dissing it. Any of you on the call or listening who do great in standardized test scores, I salute you. Good on you. But it's only going to get you so far, because in the heat of the night where you have to get back out of bed and go back and see that patient, answering C does not apply.
That's right. So, and you mentioned, and so along the way, you had good mentorship, and you actually mentioned someone I know who's dear to you, Dr. Freddie Fu, who's an internationally renowned surgeon. Who others? So that was, in fellowship, we can form some really good relationships because it's a bit of an apprenticeship. But, who were some mentors or even just role models as a young man growing up?
My biggest, I'm a fan the most of my parents. They're both deceased, but hardworking, kept the family together. My dad, he was tough on us, but he never once said, "I'm too tired to go to work," or "I'm going to take a sick day." He wasn't that guy. He would come home from a long day on the docks, and he'd be inside the garage after dinner fixing a car, or he'd be drywalling a wall, or he'd be rebuilding a fence. I don't know how he learned masonry. The guy was like amazing, and so really indelible mark it left on me about hard work, and never kind of really, these terms are real, and I give talks on things like mental health and the work of the day. And so I completely respect when mental health interferes, but he was not a guy who burnout didn't really enter his brain. It was like that he just didn't do that, He yelled a lot, but he wasn't burnt out,
So hard work came from Dad.
Yeah. So that was my dad. My mom's a lot of empathy type of person, so really brought that forth. And so then beyond them, the key people in my life, I can name a couple. When I was in med school in Illinois, this family took me in, and they were the Girardi family. So George Girardi was a medical student like me, and he told me, hey, come to Peoria, because we had a choice after the first year at the downstate campus in Champaign. You could either stay there and do an MD PhD, or you could go to Rockford, which is in the north of Illinois, but west of Chicago by an hour and a half or something by car, or you could go to Peoria. And I thought I was going to Rockford. Then I met this guy, George Girardi, and he took me home to Peoria where he was, and his dad was a Italian guy and owned a restaurant and was loving and not Mexican American, but Italian American, same family values, really loved on me, took me in, took care of me. And he said, oh, my brother's playing baseball at Northwestern. I'm like, okay. He says, let's go watch him play. And so we went to watch him play a couple times. Long story short, that guy became Joe Girardi, who was a member of the Cubs, caught winning games again by great pitchers for the Yankees, then was the Yankees manager for 10 years, 90 wins a year. For 10 years, he was 900 win guy, and he got fired. But my point to all that is a great, loving family that was a lot that looked like my family, even though they weren't Mexican Americans. They just were all about, family first, lots of arguments at the table. It was a comfort zone that I was in that I could relate to. And so I just respect them a lot because they made me feel comfortable in an uncomfortable place. A Southern Californian in the snow, in the plains of Illinois. I should have had mental health problems, but but I didn't. And I think they're one big part of that. So then after I got to Harbor General, I think some of the people you would say, Dan Zinnar, a guy who works really hard and keeps his nose down, really is about the work. That was a great role model to see. And then when I went to Pittsburgh, Dr. Fu, just an amazing man who, and I think it's this weird thing. My dad yelled a lot. The Girardis yelled a lot. Dr. Fu yelled a lot, and he would say it with his. And my father spoke with a really heavy accent, and so Dr. Fu would speak with a heavy accent, albeit it was a Mandarin accent, not a Latino accent. And it just resonated with me. Guys who just get the most out of you, and sometimes kind of tear you down a little bit, but really have your best interests at heart. And so the stories about him are legendary. About who he saw himself as, you want a second opinion, just call Freddie Fu twice. He's a funny guy. He had a lot of jokes, but what he was to me was a guy who stayed in contact with me long after my time with him. It was just 1 year and only 4 months with him specifically, but it was an indelible mark. And so Chinese like the figure 8, and multiple 8s means prosperity to you. So years later, he would just text me. Back in the days when we had beepers, he would beep 88888, and then later on he'd text me 88. Like he's like saying, "I'm sharing my prosperity with you. I think about you," and I bounced a lot of stuff off him, and he stayed in contact because I think you and I can both agree our orthopedic fellowships are like any of the other fellowships. Some of the people, it's a one and done. It's the year, and after that, you really have no contact with the person. But the ones who are great, they continue to stay in contact with you. And he's one of my biggest cheerleaders. Right. And so really hurts to know that he just recently passed, and it still is something I think about a lot. But then the other person who hired me at Kaiser Permanente was Jake Ishkanian. So here it is again, another immigrant, this time from Armenia, by way of Lebanon, where he did his American University in Beirut. Like he knew Steve Kerr's dad because that guy was the president of the university at American University of Beirut until he was assassinated. So he knew the Kerrs too. And he came to America. did some training here, and then he was the chief of the orthopedic department when I hired on there. And I had already mentioned Dr. Zapanta in that year between Freddie at Pittsburgh and then Zapanta at East Side Orthopedic and in good old East LA, and then into Kaiser and Dr. Ishkanian. And Ishkanian was the kind of guy, he could just see a lot in people. He said, Ron, I think you're going to lead this department in 3 years. I'm like, it takes 3 years to partnership. So 3 years and 1 month to the day, he says, I'm no longer the chief. You are.
Wow.
So a lot of responsibility early on. And I was stupidly naive enough to not know the effort that I was taking on. You know, when you're young, you're dumb. You're like, I can do this. I can do this better than him. I can do this. And so you just muddle through and figured it out. But in the Kaiser system, there's you got to retire at 65. Some people would say that's age discrimination. I'm going to try and take them up on that later. You have a good lawyer? I need one. No, I'm just kidding. But we had a bunch of guys at 63 and 64 when I became chief. So I would, as they had to retire out, I would replace them. And they were all generalist orthopedic surgeons. And the new way of orthopedic surgery was to have a bunch of specialists, a total joint surgeon, a sports shoulder surgeon, a hand surgeon, what have you, foot and ankle. So as they would retire out, I was just building a more like academic looking, a more modern looking orthopedic department. And after 10 years, I was able to pass the baton on to others. So mentorship, it looked like that. It looked like immigrants, just like my dad, some who yelled a lot, all with kind of broken English accents, but really wonderful people who believed in me. And maybe the imprint my dad had on me made me seek people that looked like him. You know, it's interesting.
And I love it, and the fact that so many people do look to their parents for that work ethic. And like you said, your dad was a longshoreman. Maybe he didn't know what an orthopedic surgeon was, and you didn't know to ask him. But that work ethic is what I've just known your story has propelled you to where you are today. In addition to all that mentorship, and I think it's so critical. All of us have received mentorship, or you go away to school like we both did, and having sweet people really just reach out and welcome you. You had the Illinois, I had the Southern hospitality. I think is a critical aspect of maintaining a base, if you will, outside of medicine because of the long road that you encounter. So thank you for sharing that. And so along those lines, I wanted to ask you, what would you say was one of the biggest challenges you face during that process of your medical education, medical training, and prior to getting to your career or being a full-fledged orthopedic surgeon?
Yeah, I think, some of the work ethos that you take on, it can change when you get into an environment you're less familiar with. So I think when I was in Illinois, it was probably a little bit harder to bear down and study because I was missing home and people. And so I didn't have the maturity to kind of work through that all the time. And as a result, probably some of my grades suffered, some of my ability to focus on standardized tests suffered. And there is a certain, maybe I was burnt out. There is a certain time where you're going so hard and you're like, I'm not going to go as hard. It's kind of a rebellious type of period that I think I had. I was like, and I can't, it's funny too, because I knew that I wanted to be an orthopedic surgeon. So I was like, Krebs cycle, who cares? You're like, really? Like what? Like, this is not going to matter at all. It's going to matter for somebody, not for me.
Right.
And all the people are listening and still have to study the Krebs cycle. It's very important. You should memorize it.
Very. So going through that was a bit of a challenge, but then ultimately you were resilient, and ultimately you made it. And there's so many accolades. Dr. Ore had mentioned them, and I wanted to ask, at this point, what has been one of your greatest accomplishments, what you're most proud of in medicine?
No, God, you hate to kind of like talk about yourself in a braggadocious way, like to say, oh, I did this or I did that. Maybe, I want to throw it on you. I met you when you were a third-year resident, and we started first taking orthopedic residents from Harbor because I wanted to kind of give back to the orthopedic department there that had trained me so well. And for those of you who are on, it's a real kind of county oriented department. It's a county hospital, takes care of indigent, and the surgeons get to do a lot and take care of people. They get a lot of responsibility early on, and so my swagger, if you will, a lot of it is maybe from my mom, but also it's from being a Harbor trained guy. Like, I know I can operate. Might not always pick the right C on the test, but I can operate with anybody. And so that kind of thing really helps you. And so I wanted to give back. So we started with the residents. You were the first resident. And then interestingly, they switched the residents and said, instead of third years, they have to be fourth years. So to all listening, I got to work with Ivan a second time. And so he did his fellowship, and I tried to support him as much as I could in his fellowship. He knew some of those guys, and he got the fellowship because of him. And I would hope that my letter, because I've become fairly well known in orthopedics, lended some credence to who he was after the time he had left USC in his undergrad era. And so people got further validation, but then Ivan went on and joined Kaiser Permanente, and I've in that sponsorship vein, I've been able to kind of throw stuff at him, and he doesn't say no. And some of the stuff has really led him to become a really well-known surgeon in Southern California. Permanente Medical Group, the physicians arm of Kaiser Permanente. We're the Permanente. So I think that's a thing I'm proud of, that I'm kind of giving people opportunities and boosting them up, and because other people did it for me. So those are the things I'm the most proud of, that there's a legacy that people like you will continue on, because I'm 61 and have to retire at 65, and I'll be out of here soon, out of Kaiser. I'll probably get another job because I'm a workaholic, but people like you will still be there, and you'll do great things, and it won't be because of me or for me, but you'll do it just because you're the right person for these jobs that you've taken on, and you've done great work in them. So I think, I can tell you about trophies or things I've done to propel Kaiser Permanente and that sort of thing. And if you want to hear about them, we can talk about those. I think some of the stuff besides that, some of the stuff outside of KP, just recently I was named a deputy editor of the Journal of Bone Joint Surgery. It's the biggest journal in orthopedics, most respected of the American orthopedic journals. And for me to be an editor and be in kind of like a private-demic setting where I've done a lot of research with others, and multiple others have helped me to do the research, over 100 publications and this sort of thing. But it's allowed me to develop the gravitas to kind of become a part of something I respect so much. And that's kind of an accomplishment to me that's personally fulfilling. So,
yeah. And it goes without saying, and this, I've always appreciated your mentorship and your sponsorship, because you do talk to me about it all the time when we host events with our Shoulder and Elbow Society. And so you continue to mentor. And along those lines, you're at the KP Medical School, so you are educating some of our future physicians. So if you have a medical student who's aspiring to go into orthopedic surgery, what advice do you give them?
Oh, wow. It's so competitive. And I've shared some of the numbers from this most recent match period earlier on this podcast webinar. And so a lot of this is fairly tactical, but you got to meet people who can write letters of recommendation. But very first, you have to be diligent in the school, and if there's honors associated with your medical school, if you can honor in many of the courses, especially surgery and internal medicine are the biggest ones. that shows that you're you have the capacity. Then certainly, once again, the standardized test scores. If you are a great standardized test scores taker, that's great. But if not, you should probably take courses in order to enhance your score, because there are courses out there that can help you with that. And then if you can do some modicum of research, because that shows that you have the capacity to understand the scientific method and to work through problems, because the residencies, they'll want you to be able to kind of get involved in research for at least part of the time. And many of the residencies now have a research track where you spend a whole year. So if you show a capacity for that, that can earmark you for potentially one of those spots. And then lastly, like I said at the top, the letter of recommendation process to get people who hopefully can exert influence. I can personally text people who are the chairs at multiple well-known orthopedic programs in the country, because I've taken the time to get to know them, and that can benefit students. So those are the things. I am tactical with the couple of medical students at the Kaiser Permanente Medical School. I'm friendly with them, but I tell them it's lines on the CV. It's lines on the CV. They've done studies on this. And if you have 16 lines, and I went by lines, everybody, I mean, you can have a poster, a paper, a talk. You can, be a primary author on a paper or a secondary author. It's all those things that show up that show that you're actively involved. And the one study just recently I read, it shows if you have 16 lines on your CV, you have a greater chance than people at 12 or less lines have less good chance. So, and that's only the research and participation parts. Like, once again, you got to get the honors, you got to get the research, you got to get good standardized test scores, because that's the first pile. If they get 200 applications and they have 3 spots, they're going to say, we got to cut this in half because our people can't review all these. I mean, that's just the truth, the terrible truth of how people have to deal with this. And they want to make a first cut, and probably the score is the first cut, because the residency programs are graded by the residency review committees. And if people are getting poor scores on the orthopedic in training exam, it can knock the program into a review status, a problematic status. So I know that's one of the reasons why they're trying to make sure that people can do well on the test, because they don't want their residency programs to go on probation.
Right.
So
the Krebs cycle is important.
It's not ever on that test. With all due respect to Krebs.
Yes, exactly. But no, those grades are, now I know some schools are going towards a pass fail. Some schools still have the honors, and I think that they still highlight your didactic accomplishments as well as your clinical accomplishments. So how important do you think the mentorship as medical students going into residencies are, and how would you recommend, I'm sure a lot of students come to you, so how would you recommend medical students reaching out, or residents actually, for a mentor, because residents will also need that guidance to get to a good fellowship?
First of all, I just pray that people have emotional intelligence, because they have to be able to read the audience. And even if it's an audience of one, of somebody that they're trying to become acquainted and familiar with. And if you have emotional intelligence, say, this person probably likes me, we're hitting it off, this is a good source of potential, further mentorship and relationship, to a professional relationship, to grow something. And if you have great emotional intelligence, I think a lot of Hispanics do. It's something that I think maybe, if I can be so bold, some other races don't have it as much, but Hispanics are really good at knowing, I got a good sniffer, that person's going to be nice to me, right? I'm not getting a good read on that person. And so that's the very first thing. You got to be able to pick people that you think are going to stick around with you. And then once you do, I think you need to be, and this is not my original comment, if you've heard it before, I don't know who to attribute it to. You got to be a feather in people's cap, not a pebble in their shoe. And the one thing I've seen from current generations are, a lot of them just say, like, hey, what are you doing for me? It's like, no, how can I help you? How can we grow together? I'm willing to like do a lit review and then provide it to you in the next couple of days and show you that I work hard. And that engenders a belief in the person. So by the initiation of the relationship, it doesn't have to be so parochial that there's a leveling, I'm above you or I'm below you, but you actually have to kind of earn the belief of the person by actually providing the ability to show that you can do work and be productive and return texts and emails. It's that sort of thing. And that might be off-putting to some who are hearing this, but I think in the beginning you need to kind of earn your keep, so to speak. You need to, as the young person, you need to say, this person has what I want. And so I think I need to show him that I'm going to try and earn some of it, not just expect it. And that's the one thing I see sometimes with some of the younger generations. They're just like, so, you know, when are you going to write me that letter? I'm like, I barely met you, you know.
Sure. And would you just think that comes back to just what you've gone through? And so the work ethic is so important to you. And that goes back to also kind of reading the individual, as in your particular case, you know, I mean, that's true of anything, right? I think that, like you said earlier, you can have someone who does really well on the exam, but when it comes to those clinical rotations, when it comes to having to wake up in the middle of the night because you're having to get called to for a consultation, that's when the work ethic comes into play, and those really matter in the clinical rotations. Would you agree?
Yeah, absolutely. Absolutely. And people read that and see that. I can tell you, because we're kind of talking about students and going through the process, the sub-I is the most abnormal time because you're linked with a bunch of other people who are vying for the attention of the residents and the attendings. And so it's such a contrived relational experience. So if you can just be, I'm just going to try and help people out. I'm going to be a feather in their cap, not a pebble in their shoe. I've had residents from our institution who would say to me, you know, I'm really interested in sports and And then during the rotation, they'd say, hey, you know, man, there's a Coldplay concert. I know you're doing a case at 6 tonight, but I'm out of here. I got some great tickets to the Coldplay concert. I mean, what do you think I'm going to think? What do you think I'm going to think? Oh, good for you. I'm glad you get to see Coldplay. I'm going to think, this is your time with me. I thought you wanted a letter, you know, you see Coldplay anytime.
Right,
maybe not. Are they broken up? I don't know.
They're not. They're still playing. They're still playing. I wanted to. I know there's other topics we wanted to pause for a moment and give us an opportunity for people to ask questions. Actually, one particular question. It says, "What advice would you give IMG students with the goal of matching in ortho?"
No, it's a really pertinent question. I'm actually mentoring a couple students right now who are involved. Maybe that the person who's asking is one of them. But I think it's really critical to potentially, if you already have a license, and you know, I'm going to approach it from the way I've already told the story from. If you already have a license and are able to practice as a physician, and maybe you can do some moonlighting to kind of help cover the expenses. If you can get on with a residency program that has traditionally shown interest in people of color, people who are IMGs potentially as well, and they've taken a couple, that shows that they have a track record. Some I've mentored, I've seen that they unfortunately got on at a place where they've just never taken an IMG. So they're actually doing research at the location. And typically, and this happened during those 2 years that I was at UCLA, typically a resident will get sick and then they'll say, hey, Navarro, I know you're just doing the research, but you already have your license. Can you go fill in for that resident for a couple of months? And you get to fill in. You actually act like a resident for a couple of months. That can really buy you a lot of potential relational benefit because you're actually living the life for a couple of months while that resident's sick. It just happens. And so you got to go to a place that if you're already got your you know, you have your license, you're out there, go to a place and do research with a group that is really going to be productive on the research side, really has really big name people who are going to be able to go to bat for you if you work hard for them and get research out for them, and then develop a relationship. You go out to dinner, you get to know the person, they get to know who you are as a person. And then they actually have shown that they take people, because what happened with me, I got into the place that I was at as an intern. And I think a lot of the studies show that people who don't get into ortho, whether they be allopathic or osteopathic med schoolers who didn't get in originally, or medical grads from other countries, they typically more likely get into places where they did rotations and or research at, because it's so much harder to develop the relationships with people across the country, unless you have a person who is writing you letters, who has a lot of influence and can call up people or text them like I do and say, hey, you got to take this person. They are amazing. They've already proven here. They may have had a bad score, or they may have come from a medical school in a different country, and they've done all the right things to show that whatever had made them be what you traditionally don't see as a person you'd accept into your program, they've done all the right things to prove to me that they're that person. So I don't know if I was concrete enough for you, Ivan, in that response, but
no, I think it was definitely helpful, because I think that's true. Again, I'm going to go back to what you were talking about, work ethic, right? Because if an IMG or anybody who may have not is trying to find a spot, it's that work ethic, and whether you choose to do like you did intern year and show your stuff, or do 1 or 2 years of research. I currently have a resident. She's an international grad, and she did 1 year at a very reputable research facility, and then another 2 years at a different, and she just published a ton of papers. And then, the people that she got to know was unbelievable. And those people were the ones that ultimately made those phone calls. And I think it goes back to what you said, that mentorship and that sponsorship is so critical, but that does not come just out of the blue. It comes with just working really hard and showing what you are capable of doing. So now,
gaining professional trust, right? You're gaining professional trust. I trust this person. They've shown they can deliver, they can get the work done. They have common sense, they have good sense, all those things, they're affable, they're available, all the A's too.
And so you are in Southern California, and you work in a 40 to 45% area Latino. Talk to me about your background and how you think that has influenced your care and improving your quality of care for the Latino community.
It just tickles me and heartens me when a person comes in who looks like my dad or my grandfather, either broken English or mainly Spanish. And, I'm going to tell you guys, my Spanish, if we're talking about art or other topics, is not the greatest, but I can talk orthopedic Spanish all day long. And so, hey, I was the last guy born in the family.
That's right. You spoke Spanish. You spoke Spanish in your house, right?
Right. That and Cholo.
I was going to say, I'm so sorry. I should have prefaced my question by, the one other, you practice where you grow up, right?
Yeah.
You are an orthopedic surgeon in the same city or adjacent city where you grew up. And so I think that is so admirable.
Yeah, I feel like I'm a whole small town doc in a big city in many ways, because I see the kids of the guys I went to high school with and played high school football with. It's really amazing. But when I see those patients, to your original question, I just have a special empathy for them. Not that I don't have that same empathy for other people, but you have an affinity and you just say, gosh, I want to help this person out. They're not quite getting it. They seem like they're so confused because all these other doctors are just not taking the time to communicate with them. So you take that extra minute, you'd say jokes and laugh with them, and you kind of build up their belief and trust in you, because you can imagine how these people come into a clinic, they even see a guy like me, they go, that guy's a white guy, he doesn't really get me. So I gotta I got to get him to get me. And so by showing him who I am a little bit, taking off all the masks, that builds their trust in me. We're talking trust again. It's really important too, right? And so when they see that, they probably share more, and they give me more so that I can work with more in terms of those really difficult conversations about, do you want this surgery or not? You and I do very similar surgeries, and they're all elective. Majority of them are elective, beyond the fracture work we do. And so people have a choice. They can get it done or not get it done. And if they trust in me, and if I build that trust with them, and I think I know how to build a trust with people from my own community, from who look like me or my dad or my grandfather, that it's just so much easier for them to relate to that, you know. And so that's all I've done. I don't think there's any magic to it. I think it's just trying to get down on the same understanding of communication with people so that they can feel like they can relate to you.
Great. And you, like you said, build that trust with them, right?
Yes, sir.
Looks like getting an alert, we are down to the end, and I'm been asked to do some rapid fire questions.
Okay.
Are you ready?
Yes, I'm ready.
Okay. So
you were a quarterback in high school. That's the first question. What did I do? What position did I play in high school? You played quarterback.
That's right. You have, that's the other thing. It's like a trivia. You can remember people's football positions. It's kind of one of these special traits that you have. It's unbelievable.
It's St. Genevieve. You went to St.
Genevieve. You're right. Yeah, small little school. So what is your favorite city?
My favorite what?
City?
Oh gosh. Besides the great community of Los Angeles, which is many different places, as everybody knows who've been here, our family loves going to Maui, and we love Wailea side now too. Just it's the one place. I'm very antsy. I'm you know, I got a lot of ADD, adult ADD. I'm not self-diagnosing, but I don't like staying in one place. But Hawaii's the only place I don't want to come home from. You know.
Okay. All right.
This is really relaxes me. Sorry, these are quick. I'm messing up. One word answer to you.
What's your favorite surgery to perform, and why?
I really love doing the reverse total shoulder arthroplasty. It's newer, and I think there's still a lot of technical changes that have gone on with the implants and devices, and so we're always iterating on the operation, but it requires a lot of exposure of the glenoid or the wing bone side of the joint, and I think I can expose the glenoid really well, because I think there's a lot of people, what do they say? Pinhole incisions are for pinhead surgeons. And so I could see it wide.
Okay. Now we didn't even touch on it, but I know, you have published a lot. You've traveled all over the world presenting different papers, but tell me your favorite restaurant you've had the opportunity to eat.
Woo, gosh. Oh boy, that's hard. It's a funny story, but it's Jean-Louis. It's in the Watergate Hotel in Washington, D.C. I took my parents there to an academy meeting. We sat with all these wealthy orthopedic surgeons, and when the bill came, my dad said to me, "Mijo, we could have had like 1,000 Domino's pizzas with the same amount of money you're paying for here." And I said, "Yeah, Dad, I know." And the portions were small, Dad, but it was good. He liked it anyway. I covered him.
You got him. Good. That's good. That's honorable of you. Okay. Let's see. What is your favorite thing to do outside of medicine?
I love my wife. I should have given her a lot of credit because she puts up with me and my girls, and we like doing those vacations. But I'm really into choreology right now. It's reformer type fitness. I did my workout this morning at 6 a.m. at this place. It's called choreology. It's just core fitness. I have glutes finally, Ivan.
Oh, okay. Okay, last one. I'm going to ask, what is the best advice you've ever received, and what's the worst advice you've ever received?
The best advice I've ever received was to just persevere and keep working harder. And from that was from Freddie. one other piece of advice was from Jake Ichkanian, the guy who hired me at Kaiser. He said, buy a little bit beyond your means when you buy your home, because you'll be able to grow your income into it. You'll never be sorry for that. The worst advice was from a medical school guy who was giving advice. He said that I should have become a psychiatrist.
Well, you should. I wish you could find him and let him know what happened. That'd be great.
Yeah.
Well, thank you so much for taking the time. I'm going to pass it over to Dr. Ore.
Thank you so much. I think this was a wonderful conversation. I think that there's a lot of pearls of wisdom for medical students and residents. And so really thank you to both Dr. Navarro and Dr. Garcia for joining us for our 16th installment of Inside the Operating Room tonight. I also want to thank all the participants who tuned in this evening. And if you're interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org and on various social media channels at Latino Surgery. And the recording for this event will be on our YouTube channel shortly. Buenas noches a todos y muchas gracias.
Gracias.
Buenas noches.
Buenas noches.